Member from Kenora-Rainy River.
Thank you, Speaker. Yesterday I asked the Premier a very important question. I asked her what steps this province is willing to take to ensure that First Nation communities no longer have to declare states of emergency to ensure they receive essential services that every other community in this province takes for granted. I would like to start off by saying that I believe we have common ground in agreeing that the situation in Ontario's far north is not acceptable. With this debate, while this debate was sparked by a declaration of emergency in the Nisga'a First Nation, I believe it's fair to say that in reality, all communities in the far north face very similar positions. Last year, it was Attawapiskat who declared a state of emergency as a result of a housing crisis, a crisis that exists across the entire far north. At the same time, children in Cat Lake wrote open letters to their family members asking them to end the cycle of dependency and drug use that exists in their community. First Nation communities across the far north are reporting addiction rates of 50 to 85%. This is an epidemic. In 2011, it was Pekanjikam who declared a state of emergency as a result of a lack of safe drinking water in their community. In 2010, Fort Hope asked the government for assistance with their prescription drug abuse. In 2009, it was Pekateno First Nation seeking support for a suicide crisis of their own, and there are many more. Despite the alarming similarities, each state of emergency has been treated as a singular crisis. But I know, and I know as the former Minister of Aboriginal Affairs, the Premier knows, that this is not the case. Speaker, this is not a partisan issue. This is an issue of respect, fairness, and human decency. We all know that a large part of the blame lies with the federal government. I recognize and I understand that. But that said, I believe that we as legislators in the province of Ontario need to look at what is occurring within our borders and say that we will not accept these conditions regardless of jurisdiction. I cannot look at the conditions that exist in these communities and condone a jurisdictional fight, because that's how nothing gets done. While the province and the federal government fight over who is responsible, the residents become victims of neglect and indifference. Yesterday, the Premier stated that the problem is complex, and I will admit the cause of the current suicide crisis in Nisga'a is multifaceted. This includes a high rate of prescription drug abuse, sexual abuse, the lack of access to clean drinking water, inadequate policing, no access to mental health and addictions counseling, and more. Last year, I read in this House letters from children in another First Nation community outlining the sense of despair and hopelessness they felt because of the lack of proper educational facilities in their community. That sense of hopelessness changed when those same children found out they had been approved for a new school. From despair to joy, simply by being told that their basic needs would be met. And that's what I'm seeking from the province. In Ontario, we need a strategy regardless of what the federal government does or does not do. People living in our province's far north are citizens of Ontario, and the province needs to step up to ensure that these citizens have their most basic needs met. We can fight about who picks up the tab later. We need to close the gap between First Nations and non-First Nations education funding. Even Don Drummond recognized that. We need to ensure that First Nations in the far north have adequate housing. Nobody should be forced to live in an overcrowded shack with tarps instead of doors in climate where temperatures frequently plummet as low as -50 for half of the year. Communities need support for community policing initiatives. They need proper access to health care and addiction services that do not currently exist. Communities need access to infrastructure funding that will allow them to connect to the hydro grid, which will allow them to build housing and other facilities such as community centers that will improve the quality of life for the people who are living there. People living in these communities also need access to clean and reliable drinking water, sewage and water treatment plants, and a strategy that will help them clean up contaminated sites left behind by mining companies. I am under no illusions that these changes can happen overnight. Premier, what I'm looking to you for and your government for is a firm commitment to improve the lives of all citizens of Ontario, including the people living in First Nation communities. I want your personal commitment that this government will take immediate steps to treat First Nations people in a manner that is consistent with all other citizens of this province, and to address these very serious issues on First Nation communities so we can prevent the declaration of future states of emergency. That is what I'm asking for you to do, and I believe it is not an unfair request.
Thank you. The Premier, 5 minutes.
Thank you very much. Thank you very much, Mr. Speaker. And I just want to commend the member for Kenora-Rainy River for her advocacy on this file, because it's so important. It's important to the people of Ontario. It's important to the people in her riding. And I think she knows that this is a very high priority for me. She and I have been in communities together. She knows that I have traveled the north in my capacity as Minister of Aboriginal Affairs, but in my capacity as Minister of Education and Minister of Municipal Affairs and Housing and Transportation, I have traveled to many of the communities in the north, many of the communities that she mentioned. Kanjikam, I've been to Webequay, I've been to Grassy Narrows, Wabigoon, Attawapiskat, and I'm very aware of the complex needs of many of the communities in the north. So I want to talk to the specifics of Niskantika for a moment, and then I want to talk generally about our commitment. And before I begin to do that, I want to express my heartfelt condolences to the Niskantika First Nation as they deal with the recent deaths of 2 young members of their community. No community in Ontario should have to deal with those high rates of suicide. There just is there's no explanation for that, and so this is something that we have to address. Both the Minister of Aboriginal Affairs, Minister Zimmer, and I have spoken with Chief Peter Munias about ways that we can support the community going forward, and through our social emergency protocol and daily meetings of interministerial and intergovernmental teams, we've responded quickly and we've taken decisive actions to support Niskantika First Nation. On April 19th, Minister Zimmer informed Chief Munias that the Ministry of Children and Youth Services will provide funding to Noden Child and Family Services, which is a community mental health agency, to support Niskantika First Nation with a mental health trauma team that will work with the community and its elders to provide support. What Chief Munias said to me when I spoke to him is that they need people on the ground to actually interact with members of the community in an ongoing way, not flying in for a short period of time, but actually being rooted in the community and dealing with issues and getting to know the people so that there is a relationship. We've also committed to work with Niskantika First Nation, the Ministry of Children and Youth Services, Health Canada, and Aboriginal Affairs in Northern Development Canada to support an emergency coordinator to coordinate crisis response activities for the next few months in the community. And again, I will just say that over my time in my previous ministries, I learned that often it was coordination of programs because there are interjurisdictional issues, and so that coordination is very important. So we continue to monitor this crisis, coordinating efforts across provincial ministries, working with the federal departments and First Nation to explore other ways that we can provide support and assistance. But I want to get to the root of the member opposite's question, which is, what can we do to prevent emergencies like this from happening in other places? Whether it's First Nation education, First Nations healthcare, or on-reserve infrastructure, I'm committed to working with my colleagues, with the federal government, and our First Nation partners to make sure that we address these issues. That's why we work closely with First Nations and Aboriginal agencies to support prevention and treatment programs that focus on First Nation youth. I'm very concerned about the high level of youth suicide in these communities. We believe the best way to help reduce the high rate of suicide among First Nation youth is to adopt culturally appropriate prevention and intervention services in Ontario's First Nation communities. The conditions that lead to this kind of despair need to be addressed, and our government takes that responsibility extremely seriously. I know that the Ministry of Children and Youth Services is working closely with First Nations communities across Ontario to find meaningful ways of addressing this serious problem. Ontario's Child and Youth Mental Health and Addiction Strategy provides services and supports for vulnerable children and youth, including those from First Nations communities. In 2012, in fact, Children and Youth Services hired 80 new Aboriginal mental health and addiction workers in high-needs communities, which are expected to provide additional direct culturally appropriate support to 4,000 more Aboriginal children and youth each year. Our comprehensive child and youth mental health and addiction strategy will also implement an Aboriginal mental health worker training program to increase the supply of trained mental health workers in Aboriginal communities. It will expand and enhance telemental health services to provide specialized expertise to serve children in rural, remote, and underserviced communities. As we move forward on these issues, we're going to need to continue to work with our partners, the federal government, the provincial government, First Nations communities, and I know with the member opposite, because of her advocacy, I know we'll be able to continue to work on this issue. She knows how complex it is. She has a relationship with communities, as we do, and it's only by working together and not letting wedges be driven between us, that we're going to be able to resolve the problems that are so acute in these communities. Thank you very much, Mr. Speaker.